Hello everyone, this is MedZone Lectures and today we're going to be talking about cardiac tamponade. What is cardiac tamponade? Cardiac tamponade happens to be a medical condition whereby fluid accumulates the pericardium such that this fluid presses against the walls of the heart and causes other conditions. Now, looking at this diagram of the heart over here, you can see fluid accumulating the pericardium. And first of all, what is the pericardium? The pericardium is the sac that surrounds the heart. You have the fibrous pericardium and the serous pericardium. Now looking over here, this is the first layer, which is the fibrous pericardium. And then the serous pericardium, we have parietal pericardium and the visceral pericardium. And in between the parietal pericardium and the visceral pericardium is the pericardial fluid. Now looking at this fluid, this is a normal structure of the heart, so this fluid is not an abnormality. But then, with cardiac tamponade, you can see over here, we have this is still a normal condition. We have the pericardium around the heart. With an internal view of the heart, you're going to see the atriums, the right and left atriums, and the ventricles, everything in the right shape and manner. But with the cardiac tamponade, we have fluid accumulating the pericardium, and such that this fluid is so large as compared to the pericardial fluid you saw over here. And by that, this fluid presses against the heart walls, and that it results in cardiac tamponade. So normally you have less blood that is being pumped out of the heart, and that is a very serious condition. So let's look at it more into detail. What are the causes of cardiac tamponade? As you can see, we talked about cardiac tamponade and we didn't talk about the causes. Well, cancer can cause cardiac tamponade. You can have kidney failure leading to cardiac tamponade as well. Chest trauma causing cardiac tamponade. Pericarditis, which is inflammation of the pericardium, can also cause cardiac tamponade. And then we have tuberculosis, also causing cardiac tamponade. Now, when a patient has cardiac tamponade, normally we have something that we call the signs, which are the Beck's triad. Now, there are three signs. That's why we said triad. Now, with the Beck's triad, first of all, the patient develops hypotension. Now, hypotension is described as a systolic blood pressure less than 90 millimeters of mercury. So, what happens that will lead to hypotension in a patient that is having cardiac tamponade? Well, when a patient has cardiac tamponade, as you can see, the pericardial fluid is pressing against the heart walls. So, there is less blood that is pumped out. Therefore, there is less pressure that is given out into the arteries. So you have a mean arterial pressure of less than 60 millimeters of mercury and a systolic blood pressure less than 90 millimeters of mercury. Now, as you can see, the heart rate is normally 120 millimeters of mercury out of 70 millimeters of mercury, and normally we have the systolic around 120. But then when it is less than 90 millimeters of mercury, it is considered as hypotension because there's less blood that is pumped out. The cardiac output becomes low, and that is a condition in cardiac tamponade, which is hypotension as a sign in the Beck's triad. Let's look at the other sign. We have the jugular venous distension. Now, with the jugular venous distension, as we described earlier, we said the fluid is pressing against the heart walls. So as the fluid presses against the heart walls, you have at the right side of the heart, we have fluid that is going back against into the vena cavas. And as fluid moves back towards the vena cavas, you can see the pressure in the vena cava increases. And that is what you see over here. Fluid from the heart is being pressed again backwards into the veins. And that is why the jugular veins extend. So as you can see in these three pictures, you have the jugular veins being distended, being enlarged, and that is also a sign as a Beck's triad in cardiac tamponade. Now, the third sign to complete the triad is muffled heart sound. With a muffled heart sound, you don't hear the heartbeat. So when you auscultate on the chest, you don't normally hear the heart sound normally, because there's fluid that is accumulating around the heart, and this fluid is absorbing the sound. That is whereby you have muffled heart sound. So that completes the cardiac tamponade's Beck's triad. Now let's look at a summary of the Beck's triad. A simple mnemonic for you to remember the Beck's triad is Beck, B-E-C. Now the B stands for blood pressure low, which is representing the hypotension. The E stands for enlarged jugular vein, and then the C stands for cardiac sounds not clearly heard. So these are the Beck's triad: hypotension, jugular venous distension, and muffled heart sounds. Now, one thing you need to keep note of is that you don't have to mix cardiac tamponade with tension pneumothorax. With tension pneumothorax, you have hypotension as well. You have jugular venous distension as well. But the third sign is absent breath sounds, whereby in cardiac tamponade, the third sound is muffled heart sound. Now, as we talked about in the third sign in the Beck's triad, we said cardiac sounds are not clearly heard. As you can see here in this ultrasound, you can see that here is the heart and here is the pericardial fluid, which is shown here opaque. Yeah, and then on ECG, normally you're gonna have electrical impulses. Normally the QRS complex being alternative, like not being normal. We have a peak R wave and then a lesser R wave than usual. A peak is not like normal as it used to be. This is all because the ventricles are being compressed and the pumping of the heart is not regular. And as you know, the QRS complex normally talks about the ventricular depolarization, and that is why you see this in a cardiac tamponade patient's ECG or EKG. Now, let's look at the diagnostic methods. How do we then diagnose a patient of cardiac tamponade? First of all, you look at the symptoms that the patient will present, which we'll talk about in just a moment. Then you look at the ultrasound of the heart. As we talked earlier on, the ultrasound, let's look at another picture of the ultrasound of the heart. Looking at this ultrasound, you can see the pericardium is around here, and it has the pleural fluid, which is opaque. And then you have the pericardial fluid, which is opaque as well. As you know, in ultrasound, fluids are normally opaque. And then you have the descending aorta labeled over here. You have left atrium over here, mitral valve over here, left ventricle over here, and then we have the right ventricle as well over here. So with an ultrasound, you're gonna see there's too much pericardial fluid in the pericardium. The opaque structure over there is very large, and that shows fluid accumulation in the pericardium in an ultrasound. Let's look at an ECG change. With the ECG change, as you can see over here, this QRS complex is representing the ventricular depolarization. But then if you look at this QRS over here, it is alternative. It is not as usual as the first QRS. And then you see a drop in the QRS again, in the R wave especially. And then you see another peak R wave. And this represents cardiac tamponade because the ventricles are being compressed by fluids and are not pumping as they used to be. Let's look at the chest x-ray. With the chest x-ray, you have this enlarged pericardium, and this large size of the pericardium represents too much fluids in the pericardium that is giving the heart its shape that large. Now let's look at the symptoms of cardiac tamponade. We talked about the signs already, whereby we said the Beck's triad. Now with the symptoms, it is similar to that of cardiogenic shock. And remember, the symptoms are one of the ways of diagnosing a patient of cardiac tamponade. Patients normally present with shortness of breath. Patients normally present with weakness, and also in the brain, the patient may be receiving less blood, which may be leading to lightheadedness, and if care is not taken, could lead to coma if the condition is very serious. And patients may present with cough as well. So that is the symptoms of cardiac tamponade. Now let's look at the treatment of cardiac tamponade. The first treatment that we can think of is pericardiocentesis. Normally we have three ways that we treat cardiac tamponade. And with pericardiocentesis, what we do is we place a 16 to 18 gauge needle into the pericardium to drain the fluid out of the pericardium. And it's a very simple way, as you can see here. Just a needle through the pericardium, and then you drain the fluid. You don't have to make the needle touch the heart muscle, just into the pericardium, and then you drain the fluid out of the pericardium. Now, another way is a pericardial window, and this is an open heart surgery. With a pericardial window, you have to make a hole at the pericardial sac so that the fluids will drain out of the pericardium. And this is how we do the pericardial window surgery. Normally you make a skin incision. You first make a skin incision on the sternal area, and then you cut the sternum. After cutting the sternum, you make sure you create this hole in the pericardium in a very simple way as described. Yeah. Now, the third way of treating cardiac tamponade is a pericardiectomy. Now, with a pericardiectomy, you have to cut a section of the pericardium away. You don't necessarily have to cut all of the pericardium. And normally, we cut the pericardium when it is thickened, such that it's even inhibiting the pumping activity of the heart and also the contraction of the heart as well. If the pericardium is inhibiting the heart activity, we have to cut it away. And normally we do the pericardiectomy to do that procedure. So that is actually how to treat cardiac tamponade as described, and that is cardiac tamponade in a simple way.